You can't watch a football game, a sporting event. In fact, you can't talk about many things in healthcare without talking about concussions and the impact of concussions on children, adults, anybody who has head trauma is at risk. I'm here today on Primary Care Today with a very special guest, Dr. Don Liss. He's Senior Medical Director at Independence Blue Cross in Philadelphia, and he has a really interesting report. Basically, results from a Blue Cross Blue Shield Association study looking at the steep rise in concussion diagnoses. One of the findings which really caught my attention was the concussions and diagnosis of concussions in the age group 10 to 19 have increased 87% from a rate of 14.6 per 1,000 in 2010 to 27.3% in 2015. And you have an advantage, I think, Don, because you can look at members, you can see the data, and you can really try to get some evidence-based information here.
Yeah, some of the good parts of this study are that it looked at almost 1 million events, 1 million concussion diagnoses from claims information, and because it's from a comprehensive set of claims data from the Blue Cross Blue Shield Association, it includes our commercially insured membership across the country, in fact, in every zip code across the country. So it's a very comprehensive data set. That's the good side. The downside is that it is what it is. It's claims information. So all we know is that a claim was submitted and paid, and the diagnosis reported by the physician was concussion. We don't know anything more about that, about the case, other than the fact that the examining physician reported concussion. Going a little bit further, while the data show that there's a tremendous increase between 2010 and 2015, almost double the rate, pretty much all of the experts believe that there hasn't really been an increase in the number of concussive events, that pretty much all of this is thought to be related to reporting bias. So the number of times that a parent brings a child to the attention of a medical professional after head trauma, the number of times a coach or a school district won't allow a kid back on the playing field after an event, the sensitivity that the entire population has now to concerns over mild head trauma are undoubtedly leading to more medical evaluations where head trauma, fortunately usually relatively minor head trauma, is diagnosed. And again, the good news is that medical professionals and lay people are taking this much more seriously.
And you're right. I think there's a lot of education out there. I know even the NFL right now, there's discussion as this season goes on about the viewing ratings and whether or not concussions are causing the decline in ratings, whether it's the change in the rules associated with concussions, whether it's the movie Concussion. But there's definitely this impact of something that I would have to say 15 years ago. Most people would say, you hit your head, boy, you got your bell rung, and, people went back to games, and that was happening at all levels. There has to be a positive side to this that young children, high school students, college students, it's being recognized, and hopefully the danger of repeated concussions is being prevented as well.
Yeah, I almost feel bad for the orthopedic surgeons because now it's the neurologist who's the feature physician on the NFL shows.
That's right, because they have to do that, and usually there's an independent, neurologist who gets involved. This brings up a really interesting topic because, we have a physician audience, healthcare provider audience. It's a real example of how you're able to start using data, in this case, insurance data, but what we're finding with electronic medical records is we're seeing more and more data from throughout the country where a lot of what we do as physicians is less anecdotal and more evidence-based. Maybe you can talk about that a little bit too, because just the mere fact we're having this discussion here, and you're able to say 87%, and then you're looking at the increase nationally, which might be it's about 71%, and you're able to break it down. These are numbers we really didn't have or weren't shared or just weren't talked about as much probably 10 years ago.
Absolutely. The ability to capture this information in the ordinary course of what we do every day. In my world, it's about processing claims and abstracting clinical information from that data source. In practicing physician worlds, it's using their electronic health record to discreetly identify the diagnoses they treat, the procedures they perform, the medications they prescribe, and then the use of big data, that is compiling all of this data across numbers of different reporting data sets and making sense out of it is clearly helping us gain insight, so it's not anecdote and expert opinion. We can really look at case series that are collected in typical community practice, not in controlled clinical trials. We can use that information to glean all sorts of insight that otherwise we'd be making guesses.
And I would think, and I mean, I mentioned at the beginning of the program, I'm speaking with Dr. Don Liss, and he's a senior medical director at Independence Blue Cross. And for those of us who are listening who are national, Independence Blue Cross is based in Philadelphia, but you get involved in the insurance industry as a physician. And there was a time when you had physicians working for hospitals, physicians in private practice, physicians in the insurance industry, all sorts of people kind of going at things from their own direction. With the changes in healthcare now, it's as if everyone is getting together and finally all sharing information, knowledge, the role. And I think as a physician at its very pure level, you must love that because you're now able to use claims data or other data and help doctors who are out there maybe working at the university, and they're able to give information to you to help the doctor in the private setting. It's starting to really come together probably the way it should have a long time ago.
It is. So when we can have collaborative relationships with physicians and bring them information that they otherwise wouldn't have known, for example, medications prescribed to their patients by other doctors, information about procedures and services that their patients may have received at hospitals that aren't part of the healthcare system with which they participate. Information about, we have information about use of medications that may interact with other medications. Opiate prescribing is obviously a hot topic these days, and we can bring information about prescriptions of which they weren't aware previously. That's a good day in my business when we can provide such information. And likewise, when we can glean information that's much deeper about a particular individual than we would know from claims records. So having information about the details of their cardiovascular status, for example, instead of just a diagnosis of congestive heart failure, so that we can understand a whole lot more about them and hopefully provide support, provide services that would help someone avoid hospitalization and avoid complications that all of us are trying to avoid.
You know, one of the things when we talk about concussion, and clearly it's not something you want to miss, you want to diagnose it, you want to get it right, but there are some risks associated with overdiagnosis that maybe people might be overreacting. Even the physician's like, well, you know what, we'll just call this a concussion now because I have concerns. I really don't want to step over that line either. Maybe they're not getting the impact testing or whatever, and it's just kind of written down. I would think that can then impact physical activity, the child's relationship with friends, a lot of other things, especially in that 10 to 19 age group.
Yeah, it's always a balance. I said earlier, you can't get a concussion playing video games, but there's other problems if you limit a kid's activity to video games. So we've got to avoid the sort of knee-jerk reaction to go too far the other way. Physical activity is important. A prudent, active, healthy lifestyle needs to be promoted. Can't wrap kids in a bubble. By the same token, need to be prudent in making sure that after a head injury, where there does appear to be some sequelae, that the child isn't instructed to shake it off and get back on the field. So we need to have a balance.
Again, we're talking a little bit about data and using data. Where can we get in trouble with it? Like when do we get, even in this case or others, when we have too much data or we take too much out of it? In your career, and I know you deal with these numbers a lot, where have you seen where maybe assumptions have been made or errors have been made because the numbers are telling you one thing, but they may not necessarily reflect reality?
Well, some places where we run into trouble is when we sort of jump to conclusions. And we see, just like in clinical research, where we see associations and we make a leap and say, of course, that must be causative. Sometimes we see that in for example, in certain drugs and adverse events. Sometimes it very well may be causative, but other times it may just be because the population taking those drugs are more prone to the medical complications that we discover. The place that I deal with this issue, and probably not exactly where you were going, is when I find myself with business colleagues who see the information, who hear a story and want to jump to a conclusion, and my job is to explain to them, not so fast. There's lots of reasons. When we show them information about a constellation of findings and in individuals who are frequently hospitalized, they'll jump to the conclusion and say, we'll just fix those symptoms and they won't be hospitalized. We say, not so fast. When somebody has congestive heart failure or complicated cardiovascular disease or cancer with complications, any one given circumstance is usually not the answer. It's usually a series of events that happen together, and we need to keep that in mind. So in my world, the biggest risk is jumping to conclusions.
You know, it's really interesting you talk about that because I'm involved in not only seeing patients, but I'm involved obviously in my roles as CMIO and looking at electronic records and how we use them. And so I talk to doctors, and many of them will say, you talk about the readmit rate for congestive heart failure at 30 days, but you don't understand how difficult it is to get patients to take their medicine or not eat potato chips or not do this. And, why isn't there more of an understanding? And, you hear that, or you will hear another argument, which is often something's being measured on how well they do with their hemoglobin A1Cs for diabetes or whatever. And they're like, well, I don't have patients who are eating the proper diets because they can't afford the proper foods. And there's all these social determinants of health that are out there. And I think that's kind of what you're getting at there. There are numbers, but then there's also situations that lead to those numbers that I guess show that we have to get more of a total approach to care at all levels, whether it's with social workers and dietitians and physicians and nurses and home nurses. We have to kind of get the whole act together and not just look at one thing.
Yeah, I don't know about you, but I'm often humbled by the fact that my intervention may be a whole lot less important than that of a social worker or a home care nurse who's much more able to address a very fundamental problem in someone's life.
Yeah, I find I'm amazed, how many years I practiced not thinking about those things. I get frustrated, I really didn't. As a family doctor, you think about a lot of things, but there were just so many issues that really never came to mind, and we didn't think about it, how much better care we could have done with that. And I think now the struggle, of course, is building a practice where you can have all those components at play and finding a way to pay for it, to get the patient what they need, and there's unique challenges because in a way it's reinventing the system.
It is.
What do you see as the biggest challenge with data like this or in your role going forward? Now that for instance, it's great to see a study like this come out, and when we're going to be getting more in different areas, what do you see as the biggest challenge in releasing information and getting it to make a difference in healthcare?
Well, so a couple things. One is we pat ourselves on the back when we publish a study and we say, isn't this great? But unless it gets into the hands of people that can actually make use of it, we didn't do much good. In this case, specifically around concussion, just simply sort of socializing it, making it an acceptable condition to be diagnosed, identifying that there are incredibly disparate rates of reporting concussion in different parts of the country. And by the way, no reason to think that there's any more or less head trauma in different parts of the country. That's probably a good thing. It turns out that the rate of, again, in this example of concussion reported in Massachusetts, Connecticut, and Pennsylvania was higher than anywhere else in the country. I'm pretty confident that there's just as many football injuries in Texas and Oklahoma and California as there are in the Northeast. Yet it seems that it's reported less. My fear is that coaches and parents and even physicians are less comfortable recognizing it, acknowledging it, and treating it, or making sure that the children aren't exposed to repeat head trauma. We've done similar reports around the use of certain procedures. We published a similar report around C-section rates, again, that shows variations that don't seem to be warranted, clearly related to local medical practice.
Dr. Don Liss, I want to thank you for joining us on Primary Care today. It was really a fascinating topic, and the time went really fast. I appreciate your taking the time to join us.
My pleasure.
This is Dr. Brian McDonough. If you missed any of this discussion, please visit reachmd.com/primary care today. You can download the podcast. You can learn more about the series. Thank you for listening and being a part of the knowledge.